Hello, and welcome to the 10th Annual National Webinar on Child Outcomes Data for FFY 2018, presented today by ECTA and DaSy. As in years past, this webinar will show highlights from our analysis of the data states submitted in their annual performance reports for child outcomes. This includes Indicator 3 for Part C infant-toddler programs and APR Indicator 7 for Part B 619 preschool programs. As a result of watching the webinar, we hope you will have learned about the findings from our analysis of child outcomes, as well as where to find more information about the analysis, and where to find resources to help you use the outcome data at the state and local level. Let's start with a focus on child outcomes. In this webinar, we present the child outcomes data that states collected from July 1st, 2018 through June 30th, 2019, and reported in 2020. As you may know, states first began collecting, analyzing, and reporting outcomes data in 2005. It was at that time that the U.S. Department of Education, Office of Special Education Programs, or OSEP, shifted its monitoring focus from compliance to results. They'd found that just monitoring for compliance to the Individuals with Disabilities Education Act, or IDEA, requirements had not always resulted in better outcomes for children with disabilities and their families. At the same time, the Federal Office of Management and Budget began to hold all federal agencies accountable for results, requiring all federal agencies to report data that show the extent to which their programs make a difference. If agencies are unable to show positive results, they risk funding cuts. That's why OSEP needs these data to justify funding for Part C and Part B preschool services. In addition, for Part C outcomes, data reporting is part of OSEP's results-driven accountability process. OSEP worked with the Early Childhood Outcomes Center to engage stakeholders in identifying which outcomes should be measured. Stakeholders determined that the outcomes to be measured should be functional in nature and integrated across areas of development. Their work resulted in these three targeted outcomes. Outcome 1, that children should have positive social-emotional skills, including social relationships. Outcome 2, that children should acquire and use knowledge and skills, including early language, communication, and early literacy for preschoolers. And outcome 3, that children should use appropriate behaviors to meet their needs. Along with articulating the outcomes themselves, OSEP also worked with the ECTA Center and other assessment experts to determine how programs must show progress. Because of the complexity of children, families, areas of disability, and service systems, it was clear that OSEP must ask more than a yes-no question about whether children made progress as a result of services they received in a Part C or Part B 619 program. Experts said that children might demonstrate several different levels of progress depending upon the trajectory of their development. They concluded with these 5 progress categories. A, some children would not show improved functioning between program entry and exit, as illustrated by the light green A line on the graph. B, some children would demonstrate some improvement in functioning, although without changing their developmental trajectory. See the blue B line on the graph. C, some children would improve functioning to the extent that they move closer to age-expected functioning, but without catching up. See the dark green C line. D, some children would improve functioning to the extent that they do catch up with their same age peers. See orange D line. And E, some children would maintain age-expected functioning from program entry to exit, the purple E line. Sometimes people ask how children who are eligible for services can enter a program with age-expected skills in Category E. The children reported in Category E are those whose developmental issues affect just 1 or 2 outcome areas, not all 3. These can also be children for whom services mean maintaining the use of assistive technology to support age-expected development. At that point in the development of the child outcomes measurement requirement, stakeholders had defined 3 outcomes and assessment experts had identified 5 levels of progress. OSEP anticipated that state and local programs would not wish to submit 15 data points, 5 categories of progress per each of the 3 outcomes. So it was back to the drawing board to figure out how to summarize the data into just a few meaningful progress statements. The stakeholder process yielded these 2 summary statements. The first summary statement includes children whose progress would fall into the categories of C and D, those who changed developmental trajectories regardless of whether they caught up, C, and those who caught up with their same age peers, D. The second summary statement includes children who would fall into categories of D and E, children who caught up with their same age peers, plus children who maintained age-expected functioning. We calculate the percentage for summary statement 1 by adding categories C plus D divided by categories A plus B plus C plus D. Category E is not included in the denominator because those are the children who had already demonstrated age-expected skills when they entered the program. We calculate the percentage for summary statement 2 by adding categories D plus E divided by categories A plus B plus C plus D plus E, all of the children in the data set. Since 2005, states have measured child outcomes using the following approaches. 1. The child outcome summary process. 2. One tool to be used by all programs statewide. 3. Publishers' online systems designed to measure outcomes. And 4. Other approaches. How did states measure outcomes for FFY 2018? For Part C, 40 states, 71%, used the child outcome summary process. That's 1 fewer state than the prior year, FFY 17. 8 states, 14%, use one tool statewide, for example, the BDI-2 or the AEPS. That's also 1 fewer than the year before. 4 states, 7%, used a publisher's online system, for example, AEPSI or TS Gold. That's 1 more state than the year before. And 4 states, 7%, used an other approach. That's also 1 more state than last year. Other approaches were item-level analyses, multiple methods, and the use of a 5-point scale. For Part B 619, 40 states, 67%, used the COS process, which was 2 fewer states than the year before. 9 states, 15%, used one tool statewide, for example, the BDI-2, Brigance, AEPS, or a state-developed tool, which was 1 more state than the year before. 5 states, 8%, used a publisher's online system, for example, TS Gold or HighScope. That is the same number as the year before. 5 states, 8%, used an other approach, including item-level analyses, multiple methods, and the use of a 5-point scale. In calculating the national estimates of child outcomes data, we only wish to include states whose data met certain criteria for quality. To be included in the national analysis, the data needed to 1. Reflect an adequate number of children, and 2. Stay within expected patterns. Specifically, for Part C, we included state data sets that were 28% or more of their Part C exiters. For Part B preschool, we included state data sets that were 12% or more of their child counts. Then, to make sure the data we used were within expected patterns, we included only state data where progress category A, that's the category of no progress, were not greater than 10%. And data for progress category E, that's the maintained age expected functioning category, were not greater than 65. For FFY 2018, 47 states met the data quality criteria to be included in the national estimate for Part C, and 40 states met the criteria for Part B preschool. The green line on this graph compares the number of states that met criteria for Part C across the past 11 years. You can see that the number of states has stayed relatively stable over the last few years, with only one state fewer meeting the criteria this year versus last year. The blue line shows the number of states that met data quality criteria for Part B preschool. The line takes a downward turn for 2018-19. 5 fewer states met criteria for Part B preschool. We take a closer look at the reasons for excluding data from the national estimate on the next slide. The 2 data quality questions we asked were 1, did the data include an adequate number of children? And 2, did the data stay within expected patterns? As the first table shows for Part C, 4 states were excluded from the analysis because of inadequate numbers. 2 of those states were excluded because they were sampling, and 2 states reported outcomes data on fewer than 28% of children who exited Part C in FFY 2018. No states were excluded for odd patterns of data in the A and E progress categories for Part C. Now let's look at Part B 619 in the second table. 3 states failed to meet the criteria for number of children in the data set. 2 states because they were sampling, and 1 state because they reported fewer than 12% of their child count. Why no states were excluded from the Part C analysis because of odd data patterns, 5 states were excluded from the Part B 619 analysis because they reported greater than 10% in the A progress category or greater than 65% in the E progress category. 1 state reported 22% in category A, while another state showed an increase from 1.21 in federal fiscal year 2017 to 12.48 in federal fiscal year 18. 4 of 5 states' data were high in outcome 3, use of appropriate behavior to meet needs. Remember that we expect very few children to make absolutely no progress during their time in the program, category A, and we don't expect to see a large majority of children who entered and exited the program with age-expected skills, category E. In addition to states excluded because they did not meet data quality criteria, 1 state was excluded because their data were deemed not valid and reliable by OSEP. Although last year, FFY 2017, some states had no 3 to 5 child count data available for this analysis, this year, federal fiscal year 2018, all states were able to provide child count data. Here then are the national data estimates for child outcomes. Starting with Part C, Summary Statement 1, Social Relationships, we see that 65% of children substantially increased their rate of growth by program exit. For knowledge and skills, it was 74%, and for taking action to meet needs, it was 76%. Although the percentages for knowledge and skills and action to meet needs are similar, the percentage for social relationships is 9, 11 points lower. This would indicate that fewer children substantially increase their rate of growth by program exit in the area of social relationships. Now let's look at Part C's Summary Statement 2. These are the children who were functioning within age expectations per outcome by the time they exited the program. For social relationships, the percentage was 55%. For knowledge and skills, 46%. For action to meet needs, the percentage was 57%. Notice that for Summary Statement 2, the area that is lower is knowledge and skills. Moving over to Part B preschool, we see that 81% of exiting children substantially increased their rate of growth in the area of social relationships. 82% for knowledge and skills, and 81% for action to meet needs. Although Part C's Summary Statement 1 was lower for social relationships, that is not the case for Part B preschool. The Part B preschool Summary Statement 1 percentages are similar to one another across the outcomes and overall are greater than Summary Statement 1 percentages for Part C. For Summary Statement 2, the percentages are 59% of children functioning within age expectations in the area of social relationships, 55% for knowledge and skills, and 64% for taking action to meet needs. for Part B preschool summary statement 2, there is less similarity across outcomes than Part C summary statement 2. It is the area of taking action to meet needs that is different, in that it is between 5 and 9 points higher than the other two outcomes for children who exited within age expectations. For both Part C and Part B preschool, the percentage for summary statement 1 are higher than for summary statement 2. Also notice that both Part C and Part B preschool show summary statement 2 percentages for knowledge and skills that are lower than the other two outcomes. It is also worth noting that these estimates are very similar to those calculated for FFY 2017. Estimates from one year to the next did not vary or varied by 1 percentage point. The only exception was Part C summary statement 2 percentage of children who exited within age expectations in the area of social relationships, which was 2 points higher this year compared with last year. The line graphs on this slide show data trends across the last 7 years. Note that for Part C, summary statement 1, children who increase their rate of growth, the area of social relationships continues to show lower percentages than for the other two outcomes, with a slightly downward trend over the last 4 years, from 68 to 67 to 66 to 65. For Part C, summary statement 2, children who exited within age expectations, it is the area of knowledge and skills that has maintained lower percentages over time compared with other outcomes. The area of knowledge and skills also shows a downward trend over the past 4 years, from 50 to 49 to 47 to 46. In addition, social relationships show a slightly downward trend from 59 to 58 to 57 to 55 for Part C summary statement 2. Now let's look at data trends for Part B preschool. Notice how similar the percentages are across outcomes for summary statement 1, children who changed rate of growth, and how similar they are from year to year, especially over the last 3 years. There was no change at all from FFY 2017 percentages compared to FFY 2018. Now look at summary statement 2, children who exited within age expectations. Although percentages from FFY 2016 to FFY 2017 were stable, percentages for FFY 2018 were down 1 point in each outcome area. This slide shows the range of completeness for Part C child outcomes data. We calculate completeness by dividing the total number of children in the outcomes dataset by the total number of children who exited Part C in that reporting year. For FFY 2018, completeness ranged from 10% to 95% with a median value of 69%. This slide shows the range of completeness for Part B preschool child outcomes data. For preschool, we calculate completeness by dividing the total number of children in the outcomes dataset by the total number of children ages 3 to 5 in the Part B child count. For FFY 2018, completeness ranged from 16% to 58% with a median of 33%. Now let's take a look at state-level variations in the data and see what patterns we can find. Here are the Part C data for Summary Statement 2, Knowledge and Skills. Notice the wide range of percentages states reported for children who exited within age expectations, Summary Statement 2, in this outcome area. Percentages range from 14 to 73% with a median of 48%. The national estimate for Part C, Summary Statement 2, Knowledge and Skills, is 46%, as we saw on slide 12. The Part C state variation displayed here is very similar to the variation we saw last year for FFY 2017. Here are the Part B preschool data for Summary Statement 2, Knowledge and Skills. Again, we see a wide range of percentages states reported for children who exited within age expectations in this outcome area. Percentages range from 10% to 76% with a median of 50%. The national estimate for Summary Statement 2, Knowledge and Skills, is 55%, as we saw on slide 2. As with Part C, state variation displayed here for Part B preschool is very similar to the variation we saw last year for FFY 2017. How can we gather information to help us interpret the variation in data across states? For example, look at the difference in the percent of children who exited within age expectations as reported by State 1 in this slide compared with State 2. Why does State 1 have so many more children reaching age expectations? One hypothesis is that State 1 serves a higher percentage of children than State 2. States that provide special education services to a higher percent of children would be expected to serve proportionately more children with milder delays and disabilities than states that provide special education services to a relatively lower percent of children. Children with milder delays or disabilities are more likely to exit within age expectations compared with children who have more severe delays or disabilities. As a reminder, Summary Statement 2 is the percentage of children that exited with the age expectations, and we would expect that it would be higher in states that serve more children with mild delays and disabilities. We investigated this pattern a bit further, starting with Part C. On this slide, you see that the green bars represent states that served fewer than 2.5% of their infant and toddler population. There were 9 states that fit in that criteria. Blue bars represent states that served 2.5 to 3.9% of their infant toddler population. There were 23 states that fit into that criteria. And red bars represent states that served greater than 3.9% of their population. There were 19 states that fit into that criteria. The data pattern is as we would expect for all 3 outcome areas. States that serve fewer children reported fewer children exiting within age expectations. This is especially clear when you compare the states that served fewer than 2.5%, the green bar, with states that served greater than 3.9%, the red bar. Let's see if the same pattern holds true for Part B preschool. For Part B preschool, the green bars represent states that served fewer than 5.7% of their preschool population. There were 9 states that met that criteria. Blue bars represent states that served between 5.7 and 7.5% of their population. There were 19 states that met that criteria. The red bars represent states that served greater than 7.5% of the preschool population. There were 22 states that met that criteria. Starting with social relationships, we see that states serving more than 7.5% of their preschool population, shown in the red bar, report the lowest percentage of children exiting at age expectations. We would expect that states serving less than 5.7% of the population represented in the green bar would report the lowest percent of children exiting at age expectations. We see that states serving between 5.7 and 7.5% of the population report the highest percentage of children exiting at age expectations. Moving now to knowledge and skills. We see again that the data do not follow our expected pattern. Although states serving less than 5.7% of the population represented by the green bar report the lowest percentage of children exiting at age expectations, we see that states serving between 5.7 and 7.5% of the population report a higher percentage of children exiting at age expectations than states serving more than 7.5% of the population represented in the red bar. Moving to action to meet needs, we see yet another unexpected pattern, where states serving less than 5.7% of the population report the highest percentage of children exiting at age expectations. These patterns are difficult to interpret. The differences between groups is small, and there are few states included in each mean, so the differences may not be statistically significant. Here at DaSy and ECTA, we know that states don't have a lot of time to conduct ongoing reviews of their child outcomes data collection procedures. To support states in taking the pulse of their child outcomes data, we annually provide each state with its own child outcomes data report, called the State Child Outcomes Data Profile. This profile will help you review different aspects of data quality for your child outcomes. The Child Outcomes Data Profiles contain valuable graphics and tables that can be used to identify trends in state performance and data quality issues that may require further exploration, or share information with various audiences. Charts can be cut and pasted into state documents and presentation materials. We recognize that COVID-19 has impacted the collection of child outcomes data. We're available to support states in thinking through the impacts of COVID on the data they're reporting through their SPP APR. Listed here are some resources that we think will be particularly valuable as you move forward with this reporting. The year-to-year changes in state child outcomes document, What Do They Mean, provides a further framework for interpreting changes in performance data across time in the context of changes to data collection processes and procedures. The Local Contributing Factors tool for C3B7 includes considerations to help understand how data quality and practices can contribute to local and state performance. The key Part C data considerations during COVID document provides a preliminary set of data considerations for state systems to understand the evolving impact of COVID-19 on the services program and administrative activities to support decision-making and assist in planning for future needs. The document was developed for Part C programs, but the content related to outcomes is appropriate for C and 619. The Analyzing Child Outcomes Data for Program Improvement document is a tool to help identify key issues, questions, and approaches for analyzing and interpreting data on outcomes for young children with disabilities. It can be used to plan follow-up analyses and dig into any unexplained patterns you may find in your data. These are some resources to support your child outcomes measurement work. New this year is Take a Look at Your Child Outcomes Data Quality Profile, a blog to help you maximize the benefits of your state data profile. Here are some additional resources. The Special Collections page features state-produced data reports for local programs. The COS-PD resources will assist states that use the COS process for outcomes data collection. Though designed for COS completion, this document will assist anyone using teleconferencing regardless of the child outcomes measurement approach. Although not specific to outcomes measurement, the coronavirus page on the ECTA website provides the latest information on funding and guidance during the COVID-19 pandemic. Nor is the remote service delivery page specific to outcomes measurement, but provides useful compiled information for states' early intervention Part C and early childhood special education programs, including technology and privacy, reimbursement, provider and educator use of technology, family resources, state guidance and resources, and research. Please reach out to us at DaSy and ECTA if you have any questions about your collection, reporting, analysis, or use of child outcomes data. We have knowledgeable staff on hand to work individually with you to identify and answer questions, review draft SPP APR language, or direct you to additional resources specifically aligned with your needs. We can also connect you with leaders in other states who are addressing similar issues. We look forward to working with you in 2021. Thank you for joining, and we hope you have enjoyed this webinar. This has been a production of the ECTA and DaSy Center. Please join us again soon.